Hi, everyone. This talk is about the commissioning of services. There is a focus on urgent eye care services during the presentation, and it was originally written and delivered by Mr. Ian De Silva at the British Emergency Eye Care Service Conference last year. However, this talk is predominantly for Inspire at present. So, the aim of the talk is to understand what commissioning means and how this would work for the provision of emergency eye care services in particular. And we also want to help them improve your understanding of how money flows in the National Health Service. This was a slide that Mr. Silva had produced to just talk about how exciting this topic is. It's not a very hot topic, and part of it could be because people don't fully understand the mechanisms, but it's also partly because we've never been involved, especially as juniors, or unless you choose to get involved in the business side of things. I think when you work in primary care and you work in a GP surgery, you're more likely to understand how services are commissioned. But in hospital services, you just get on and do your job sometimes, and you don't really think about where the money comes from. However, it can be vital when you try to improve efficiency or funding of services. So in 2022, we had the Health and Care Act. So this is what replaced the clinical commissioning groups, CCGs, as they were previously known. So in the UK, we have 42 integrated care, England, we have 42 integrated care systems, and these represent a particular area. So Mr. De Silva works in Leicester, so we can see that there's Leicester, Leicestershire and Rutland Integrated Care Board. So with regards to our spending, we can see that since 2007, we've been spending more and more on the NHS. So in 2021 to 2022, we spent over 136 billion. And especially in that year, there was a further increase in spending because of COVID. So costs are increasing, and spending is increasing too. But we also know we have staff shortages. So according to the Organization for Economic Cooperation and Development, we can see that we have the least amount of doctors in the UK per 1,000 population, and we're not too far behind with nurses as well. So how does money flow? We have this overarching body, the Department of Health and Social Care. And within that, they fund capital funds, public health services, including vaccinations and training. And then there's NHS England and Improvement, NHSEI. So within that, we have the integrated care systems, which is what we've been talking about. And they also provide funding for primary care, which is a huge sector, COVID funding, and then the military system, military healthcare and specialized services. So within the local care systems, this funds planned hospital care, such as elective cataract surgery, ambulance services, community health services, and mental health and learning disability services, but also emergency and urgent care. This is where eye care services would come under. So what is an integrated care system? It's a partnership for organizations that work together to plan and deliver joined up healthcare services. And it's meant to improve the lives of the people who live and work in these areas. So as we can see on this slide, you have NHS England, then you have the statutory integrated care system, and that can be further divided into a care board. So this is where you have a chair, non-executive directors, you have NHS trusts, foundation trusts, GPs, etc. And their role is to allocate a budget to commission these services. They can also work with integrated care partnerships. This is more public health related. So you have the local authorities, Health Watch and different partners. And their aim is to meet the wider public and healthcare social needs. And they work together. Ultimately, they influence because an integrated care service is for a particular area, they affect the systems in place, as well as the local area and neighborhoods within their sphere of influence. Then you have the Quality Care Commission, and this is the group that reviews the work of the integrated care system. So what is commissioning? Commissioning is the continual process of assessing needs, planning, procuring services, and monitoring quality. And we saw that from the previous table. It's done by NHSE and local integrated care boards. It's predominantly divided into 3 sections. The planning section, so you assess the needs of your population, and then you decide the priorities. Then we'll go into further detail in a second. Then it's about procuring the services. So you design what you need and then order whatever you need. And then finally, it's monitoring and evaluation. You want to see whether your outcomes are being met. So when we start analyzing something, we're trying to identify what the needs of a local population are, and we need to be clear about what outcome they want to achieve. But as part of that, we need to understand what already exists. So in this example, if we're trying to think about improving the delivery of emergency eye care, and we want it to be improved closer to the patient's home and reducing health inequalities, we might start thinking, okay, what services exist? Is there only a tertiary hospital service where patients have to get referred by their GPs and A&E? And currently, how overworked or how can patients access these services? Then there's planning and procurement. So you start to think, okay, there's only the hospital services, but it would be really useful if we could find further community services. And if we were to do that, how much is all of this going to cost? Because you need to cost benefit analysis. And then you try to purchase the best option for delivering the outcome that we're setting ourselves to achieve. So this could be, your local optometry-led schemes, such as the CUES and MEC service, which are the community urgent eye care services, or the minor eye condition services. It could also be an iRobot that I think Mr. De Silva was predicting might happen in the future. And then finally, you deliver the service, and you do that by, this is where your sales skills come in. You negotiate, create protocols, you make sure people are adhering to the guidance, and you're trying to see whether the population that you're trying to serve, is it actually fitting their needs? So for instance, with the CUES and MEC services, see if the schemes are fitting with your local population needs. Is it close to their homes? And are they able to quickly and easily get appointments? And then finally, you're monitoring and reviewing the service. Is it actually reducing the capacity from the hospitals so that they're able to see the true emergencies that need to be seen? And CUES and MECs are appropriately managing the patients in the community. And you're spending all this money. Is it actually worth it? So the amount of money that the Integrated Care Board receives depends on the number of people in that population, and also the level of deprivation. We also have to think about whether it's an aging population or a younger population. And it's the responsibility of the Integrated Care Board to assess the health needs of a population and purchase the services accordingly. It doesn't always have to be the hospital services. It could also be social care services, independent ones like the independent sector that people use for, or particular areas for cataract surgery, but this time for emergency services. So it's not just about hospital services. And finally, what's a primary care network? So this is where you get a network of GPs who work together with community services, and this can include pharmacists and other health professionals, physiotherapists, etc. They usually serve a smaller population, so it's not hundreds of thousands, usually 50,000, and they get a budget for that, and then work together to provide particular services within that budget. So hopefully, by the end of this talk, you've understood how money flows in the NHS. You're more aware of what commissioning means and who actually commissions money. And finally, you're going to be looking at some flashcards on understanding the 3 different models of payment, block contracts, capitation, and tariffs. We'll be discussing the advantages and disadvantages of these shortly. Thank you.